and I'm here to welcome you to The Doctor Is In. I'm here with my awesome co-host, Dr. Monique Gary. Hey, Monique.
Hi, how are you? I'm Dr. Monique Gary. I am a breast surgical oncologist in Philadelphia, Pennsylvania, and we do want to take this opportunity to welcome you back. We have been rocking with you guys on blackdoctor.org for 3 weeks now. This is our third week, and we're so excited to bring the energy, bring the excitement, and bring the compassion and the information to our breast cancer survivors, our breasties, our caregivers, and anybody who is being affected by COVID right now, because this is information that we hope you will be able to use to get yourself through this pandemic. Ricky, you want to introduce our first guest this evening?
Yeah, relatable, reliable, real information, right? So I
love it.
I have the honor of having my bestie breastie on, Mema Karma. I love her to death.
Hi, everybody.
And she is the founder and president of Tiger Lily Foundation, and we are going to talk about self-care, of which she is a guru.
Absolutely. I want to also introduce the wonderful Dr. Cheryl Rothery. Dr. Rothery is a professor of psychology and the Department of Clinical Training chair at the Chestnut Hill College here in Pennsylvania. And she has specialized really in helping folks get through the trauma of this shared pandemic experience. And so she will be talking with us about anxiety, giving us some tips, maybe some exercises we can do even on the air here. And we're just so glad that you could join us today.
Thank you so much. It's a pleasure to be here.
Great. So, Mema, what are
Ricky.
what are your secrets? Tell us some secrets about taking care of yourself. Because
I
you
have a
work
whole
like a crazy person. You work like a crazy person. How do you break it down for yourself?
You know, because my priority is self-care. That I don't binge on, I don't skip on. So my meetings mostly start not before 10 o'clock in the morning. I once in a while will do early morning, but usually it's not before 10 o'clock in the morning because my body needs to have time to rest. And so I get up in the morning, I have a whole routine I do. The first thing I do is I thank God for being alive. And so when I get up to this, all the pandemic and all the noise and all that, it's in my head, right? So I stop myself and I just tell God, thank you that I'm still breathing, that my heart's still beating and I'm still here. And then I kind of do a thing where I feel my body and feel how I'm feeling. So I kind of feel where there's tension. Is it tension is it my neck? Is it in my shoulders, in my back? And I kind of lay there and just kind of meditate throughout the whole body. And I give my body what I call little memas. I send little memas in there with like lightsabers and just energy and send myself light to learn to relax and be in my space and to just kind of let my body, just calm down. I meditate all the time. Every morning so after that, I kind of just sit there and I find a place to center in my head. And we forget that all we really have is our breath, right? All that's going on in the world, all the noise, whatever it is, chores, bills to pay, whatever we're doing, our breath is so precious. And when you don't have breath, you have nothing. And so I sit there and I love my Calm app, which I use quite often, but I just breathe in and I appreciate the breathing as my body's inhaling. Like I feel the feeling of the breath going through my lungs, giving me breath and life. And I appreciate the exhale. And I've learned to apply with the inhale appreciation and acceptance, and with the exhale, letting out things that I don't want to carry with me. Those are a few things that I do in the morning. I'll say one more thing and I'll let you guys go around and talk. But I've learned this technique that I really love, coughing, allergies. It's called butterfly tapping. And so we're all kind of right now, we're isolated. We can't be touched by loved ones sometimes. And so butterfly tapping is a way to kind of just hold your body, just hold yourself tight and feel how that feels, right?
I love hugs in my own
right,
hugs.
right. I'm a hugger too. And you just think of a time when you're really happy, whether it's, your daughter's first smile or giving birth or having that bottle of wine, whatever it is.
Ice cream
And,
for me.
and you just kind of think about that thought and you just tap little taps.
That feels really good.
And, when you think about that joyful place and you just tap, over time, your body will calm down.
That feels really good, Mima.
I know.
Did you do this before you had breast cancer, or did you start doing this after you
Oh,
went through a mess?
after breast cancer, but honestly, to be honest too, I excuse me, I was going really fast in my life, and when you ask God for things, He will answer you directly. So I love my work. We all love our work, but we all go so fast and so hard. And for a period of time, my daughter was having some health issues. So between work and being a caregiver, being a mom, and my father had 3 heart attacks, it was just so much that was happening in my world. And I had to maintain the idea of a boss, running my organization, getting things done. As a Black woman, I can't let people see that anything's dropping or falling. So I'm at home working, working, fundraising, being a boss, being a mom, having a child who was chronically ill, or not chronically ill. Yeah, she had chronic illness. um, I was very overwhelmed. And so I had my self-care tools like the spa every other, once a month, twice a month, things like that, or using my oils. But I began having panic attacks. And the first one happened, my one of my closest sisters, my best friend passed away. But I left the hospital from seeing her, and on the way back, it all just hit me at one time, and I couldn't breathe. I thought I was going to die, or I was having a heart attack. I used my breathing techniques. I used my essential oils. I just had no control over what was happening to me, and I was terrified. And so I went home and tried to breathe and to pause, and I used every tool possible. I ended up going to the ER that night because I thought I was dying of a heart attack, and I was terrified. And they said, "Ma'am, we run all the tests, and you're having an acute stress response."
This is
And so that
before breast cancer?
after cancer.
After. Okay. Okay.
And I want to speak to that because many of us who are caregivers, whether it was with a child or a parent, even a doctor, we're taking care of people all the time. And we forget how much strength we can handle, we carry all the time. And I think sometimes we're such bosses, we can handle things. And at a point in time, your body says, "You're done. I need your attention.
You're
I
done.
need your full attention. You're done."
Yeah.
And whether it comes with you saying to your body, "I'm going to pause for a while and relax," that's a good way. Or your body will tell you through illness, through dis-ease, you need to stop. And so I think that happened last summer for me. And since then, I have put in place the most radical self-care plan, which I share in my 2 recent books. One is called Divine Downloads, Transforming Through Trauma. And the other one is called Unicorn Boss. It's about how we bosses, we're all unicorns, we're all unique in our own way, and we're being badasses. But how do we put ourselves first
Yeah.
and care for ourselves?
Mhm.
And in that book, I share about essential oils, the butterfly tapping, things like EMDR, why they're important. The importance
What's the
of
MDR? What's the MDR for our?
EMDR is why am I going blank right now? It's a therapeutic mode where you kind of learn to process your trauma. They first of all they group the trauma in different groups, and then you learn to process through different means of whether it's tapping, whether it's using electromagnetic tools, whether it's learning how to like count forms. But it helps your body to release trauma because our bodies hold trauma. And when you think about Black people, Black women and men, and people of color, and how we have how we have disease and pass on disease, we've had a lot of trauma in our history, and so that trauma stays with you through your generations, through mothers and fathers and grandfathers and children and babies being born. Um, and so think of a mother passing on to her children her trauma, and they pass it on to their children. Even Eckhart Tolle talks about the pain body. In his book, I think it's called A New Earth. He discusses the pain body and how your body will hold on to pain. And
Mm.
so if you don't release that pain, it can turn into dis-ease, which means illness or a mental health issue, or we hold it in and maybe we get cancer or something else. And so I've been really tuning to my body and tuning into how I feel, where I feel stress in the morning. As I'm going through my flow, if I feel stress in my chest, do I go outside and walk on the ground and ground myself like bare feet and feel Mother Earth? You know? And so knowing your body, being in tune with yourself and your emotions, and saying that you need help and prioritizing your health. I think that as people of color, we're afraid of, people thinking we're crazy or we're not strong. We're always looking at being strong and look to as being strong. But being strong could be putting yourself first and saying to yourself, my mental health is important. My spiritual health is important, and my self-care is important. And so after I had the panic attacks, they're gone now. But that was the most terrifying experience I had, and I didn't just have one. From June 23rd, I had them every day until September, and I had to learn to work through them.
Wow.
So it literally was all the trauma of breast cancer, of escaping 3 wars, of being coming to the country of the states alone as a refugee when I was 15 years old. When I came here as a 15-year-old, there was no internet, no Facebook, there was no Twitter, nothing. My parents put me on a plane alone at 15 and said, the war has started. We want you to live. Here's some money. When you get to America, find your way, and we'll find you at some point. And so my brain just shut down that entire memory for a long, long time. And so I share it because I think that a lot of our illnesses, whether it's emotional, mental, physical, or, we have to stop and take time for ourselves. And so my major focus now, besides breast cancer, but also as part of my breast cancer work, is really integrating caring and loving the self and putting yourself first.
That's great. Mayma, I really believe that stress caused my breast cancer because I didn't believe in stress. I thought stress was a cop out. I thought it was for wimps. And so I did, like, what are you going to do? Not go to work, not feed the kid? I was like, superwoman of the, we all are, right? As Black women.
I get that, Ricky. I do, and I talk a lot.
Yeah.
I talk a lot to patients. Yeah, about the impact of stress on their bodies. And I want to be really careful not to say, that we in some way have caused this to happen to ourselves. But, stress can certainly impact the body. It can activate stress genes. And I want to pull Dr. Rothery in to talk about some of this trauma and maybe give us some historical background and some of the ways that trauma manifests in the body and expound a little bit on what Mayma's been talking about here.
Absolutely. So, Maima, I really admire you because it sounds like your self-care regimen is just excellent. And I think that's probably why you are still here and beautiful and strong and radiant today. So important.
Thank you.
And you raised so many important points. You raised the point of the generational aspects of who we are and how that impacts us, the generational trauma that we have suffered as a people. And then before COVID-19 happened, we were all living life and dealing with stressors of life, dealing with many of us with daily microaggressions of living in the society in which we live, especially during the current socio-political climate. The world has been a very, very stressful place for us always, but the last few years have been difficult in some, not new ways, but some resurfacing and challenging ways. And then COVID hit. And so what we're talking about is trauma upon trauma upon trauma. COVID-19 is a traumatic event. It's a traumatic event for the world. And there's a saying that, when the rest of the world gets a cold, Black people get pneumonia.
We have steroids right now, right?
Exactly. And so, and I know that Dr. Gary, you probably know the statistics better than I do, but my understanding is that in many places, 70% of the people who are getting COVID-19 and dying from COVID-19 are us. And so that's just one example of how it's hit us so much harder.
Article today, all of the deaths in Richmond are Black people. All of the
Yes.
deaths in Richmond are Black people. Isn't that
But
crazy?
I wonder about people of color and the immune system. One thing I learned when I got very sick, so I got panic attacks first, and I got pneumonia. And my doctor said to me, your immune system is very, very suppressed because stress does that. It can cause, because our bodies have different viruses in them that we live with, right? Whether it's Epstein-Barr or other things, we have different things our bodies build immunity up for. So we just live without them. We live through them rather. However, when you're stressed, your body will suppress your immune system and allow things to be hyper expressed. For example, people who are getting COVID are the ones who are immune suppressed, right? And so many people of color, I mean, in many instances, I've heard. And
Mhm.
so I've been talking to a few epidemiologists, as many of you have, and naturopathic doctors. People of color in some parts of our country have no access to healthy food and healthy things to repress, to build their immune systems. You go to any place in Southeast DC or some place, in other countries, you see McDonald's and liquor stores and chicken stores. You come to a place like where I live right now, Loudoun County. I love living here, but you see more whole foods and more healthier foods. And so,
Farmers
what does that tell you about
markets.
our community?
Yeah.
People of color need to have healthier foods to build their immune system on a consistent basis. And if they don't, when these things erupt, they're going to be the highest impacted for many reasons, including not having access to healthier food with better immune, nutrition and so forth in those foods.
Yeah.
It really is multifactorial, Mema. And I'm glad that you mentioned that people in food deserts and people who don't have access and people who may not know and understand the things to eat to boost their immune system. And so we're going to do a show on that, and we're going to get into that a lot more. But you're absolutely right in that, our innate ability to fight things is weakened when we don't rest well, when we're not sleeping, when we're anxious, when we are in a state of fight or flight,
Right.
Dr. Rothry, when our bodies are preparing for something bad to happen, we're not at our optimal state to fight disease. Our blood sugar may be elevated and we become insulin resistant. And so there's all these things happening in the body. And there are things that we can do to combat that. But the problem that I find is that once a patient reaches a threshold that they now have a diagnosis of breast cancer, once you reach that threshold, it is really challenging to get your body to play catch up enough to get ahead. And so a lot of times we sort of mistake the maintenance for the cure. Once we get our bodies back to balance and homeostasis, that's great. We need to build on that. We need to continue to boost our immune system. But if we're relying on our innate immunity to help get rid of things as large as breast cancers and other things, there can be some real challenges there. And so sometimes we have to understand how to balance, and I talk to my patients a lot about, and I partner with a naturopathic doctor, and I want patients to understand that it's not either or. It's using all the resources that are available to us, but getting your body up to speed and ahead of the game as far as nutrition, as far as proteins. Once you've gone through something like chemotherapy or radiation, the trauma of that on the body already sets you back. And so I want to talk to people who maybe don't have the understanding that you all have, in terms of like your oils. And it sounds like you already had a lot of tools in your armamentarium that you could draw upon. And maybe some people don't have those, and they try to meditate and they fall asleep, or their mind goes in a zillion places.
And that's fine too.
Right, like meditation for some people is not a quiet room. Maybe it's noise. Maybe it's something else. But how can a person who wants to sort of get started in developing a self-care regimen, what are some things that they might be able to do, Dr. Rothry?
Sure. And before I go into that, I do want to also add, Dr. Gary, to those excellent points you made about things like nutrition and how we take care of our body. So much of this is also based on socioeconomic status, right? That determines where you live. That determines how close you live to other people. That determines healthcare, its availability, its access. That determines whether or not you are going out and working or working from home remotely. And when you're out working, whether you have the proper equipment. And so there's so many things. And so when I think about tips, one of the things I think about is that the first tip is for us to figure out what we can control and what we can't. And so we may not be able to control where we live. We may not be able to control our environment and our socioeconomic status. And so what can we control? Even the food choices you have, as Maima said, might be based on where you live and what's available to you. We all know that fresh foods are available in certain communities and not others. And so again, it's about making good decisions with what you have. But I want to highlight the fact that sometimes we don't have control over some of the things that would put us in a good position. So I apologize. Tell me again what you wanted me to focus on. I went on my little train.
right where we need to be. You were
Okay.
in keeping with the theme of helping people who are used to, and maybe we had to get into this a little bit too. You know, what is it about Black women that makes us want to take care of everyone and everything, and almost wearing a badge of honor that we have neglected ourselves? You know,
Yes.
because we work 3 jobs, we take care of this person, that we're doing all these things. But the question I asked you was really about for a person who does not yet have a self-care regimen or a way
Right.
to deal with, or even recognizing the stress and anxiety that they're feeling. And I'll give you a great example. You know, I'm wearing a mask, you know, just out in public, and in surgery, I'm wearing 2 masks. And so
Yes.
you talk about breathing and feeling your breath. All I'm feeling is my breath, and I'm having panic attacks because I'm wearing a mask, I'm wearing face shield, I'm wearing scrubs, and I'm wearing a gown and 2 pairs of gloves, and you know, like. For the person who is in the thick of it, let's say a cancer patient who's got to go in and get their treatment and they got to walk into this hospital, or someone who's at
Yes.
home with their children and their children are anxious and, you know, they're upset too because they're stuck at home and, you know, kids are mad, mom's mad. Look, what are some things that people can do to begin to develop a self-care regimen and not just feel like another thing on the list of stuff I just can't get to?
Yes, good. So thank you. So I think Maima touched on that earlier. You know, we talked about that strong Black woman syndrome. And you're right. For many of us, it is a badge of honor. It's all we know. Our mothers were strong Black women. And so what we've needed to do for a long time, but especially right now, we need to redefine what it means to be a strong Black woman. And we need to include in that definition taking care of ourselves. Okay. When I'm working with my African American clients, one of the things I say to them is, I understand that I can't take off your strong Black woman cape. Okay. I'm not trying to take that away from you, but can we possibly give the cape a rest? Okay. Because we want you to come back bigger, badder, stronger. And when I start working with them, I say, so you can continue to do all the things that you're doing for everybody else. But I'm being sneaky because my real goal, while they're giving that cape a rest, is to work with them about including themselves in all the people they're taking care of. Okay. So again, the first thing is that serenity prayer. You know, whether you are religious or spiritual or not, that serenity prayer is a very powerful message, because what it says is it encourages us to think about is, what can I control in this moment? What can I not control in this moment? And then you ask for the wisdom to tell the difference. So we can't control that Corona is here. Some of us can't control that we are considered essential and we have to go out to work. Others of us can't control that we've been laid off or furloughed. Okay. But what do we have control over? And that's going to be different for everybody. The second thing is that we first have to allow people to feel what they feel. You know, one of the things that strong Black women do is they're on automatic pilot. And sometimes the only emotion we end up expressing is anger. You know, we hide our pain. We hide our sadness because that doesn't kind of equate with being a strong Black woman. And so we want to create places and spaces where it's safe to feel what we feel, to feel vulnerable, not feel like that's not okay, to feel afraid. You know, these are some scary times right now, you know, and it's okay to acknowledge feeling afraid. And it's also okay to acknowledge that I have a 16-year-old son. I don't want to terrify him. But if I'm sitting here being a strong Black woman and acting like everything is fine, then how's he going to feel about how he's feeling right now? You know, so my expressing myself gives him permission to express himself and his feelings. Okay. So kind of meet yourself where you are and understand that where you are might change from moment to moment and day to day. There are some days when I'm working remotely, teaching, seeing patients. I got this. I feel good. Other days, it feels like the worst thing in the world. And if I have to go on another screen, I'll just die. You know, and so I have to accept and embrace everything I feel. Other days, I am really angry, you know, about the whole situation. And then other days, I don't feel much of anything because I feel numb.
Yeah.
Normal feelings.
I'm there.
I love what you said.
I feel like we're doing more Zooms and we're busier now than we were before, some of us, like our
Yes.
days are just crammed full of back-to-back meetings because we no longer have to drive these places. So it's like, oh, great, we'll put this one in and now we'll add this one, I'll add this one. And it's a meeting about the meeting in preparation for the big meeting. And then we have
Yes.
to brief about the meeting to plan for the next meeting. And
Yes.
it can be a lot, and
It's twice as exhausting. And nobody ever thought working at home, we all thought it would be easier. It's twice as hard working at
But
home.
it's about boundaries though, right? It's putting in boundaries, whether you're working at home or not, is saying yes to yourself.
say that
It's
again.
saying yes to me.
Say that again.
So that's why I began my schedule of like 10 to whatever, but I'm like, that's it. What are you doing? I'm doing me. I did it before COVID. I have friends call me on Friday nights. You want to go out? No, I'm busy. Doing what? Watching Netflix and chilling by myself. And so I think these things are things you want to put in for yourself, is that those boundaries. Back to one of the points you all made, I think for me, self-care is strength. I become more self-care is strength. I become more confident in myself and more loving of myself and more gentle with myself in the past year than my entire life. And that's part of me being vulnerable is, when I began having the panic attacks and had to have my daughter who sees me as a strong mom who soars buildings and helps cancer patients and travels and speaks, having her see me curl up in a ball for hours crying and shaking was very, very hard for me because I have been vulnerable with her, but I've been also mostly a strong woman. And so I had to take the mask off. And as Black women, the masks have to come off. I'm tired of saying that I'm strong when I'm not. I'm tired of saying yes when I want to say no. I'm tired of saying okay when I want to say get the hell out of here. And so self-care, strength, take the mask off. And talking to the patients who are having to go to treatment when they're afraid. I mean, I had a screening the other day, some scans, and I was terrified to go in the hospital. I didn't want to go in there and get COVID. And so I sat in the parking lot for about half an hour, and I know better, but I was so afraid of getting sick. And one mantra I learned a year ago is simple. It says, God is here. God is here. And I kept saying, I was so freaked out, call my mom, call my friends. And I'm like, who am I calling? I have my masks. I have several masks on, like 3 of them. I have my gloves on, and I just said, God is here. And a simple prayer you can tell yourself at any time, wherever you are. You just can say, I just say all the time, God is here. I'll do my best as a human being, but God is with me. And I got out of my car, went to the hospital, took all the precautions and got my screening, and I came back clean. So I tell my patients, do the best you can, but if you have to go, you have to go, and know that wherever you are, God is there.
I love that you said that. Yeah.
I also talk about meditation. I want to go back to that. Meditating isn't really about just sitting still and being quiet and clearing your mind. For me, I'm a runner as well. So I run, and when I run, I feel most alive. That's when I talk to God. So it could be when you're running or walking. For Ricky, it's paddleboarding. So whether you're sitting there going and falling asleep, or just going for a run or a walk, or even dancing could be how you meditate. So I think to Doctor's point, meet yourself where you are.
Yeah.
Whatever makes your mind clear, makes your heart sing, makes you less stressed, taking a bath. I mean, those are self-care things that are very simple. So whether you're less financially have money or have more, taking a bath, turning off all your electronics and lighting a candle or two, putting on Spotify and just telling yourself, I love also saying I am statements. I am worthy. I am deserving. I am a child of God. I am loved. I deserve quiet time. I deserve peace. Saying to yourself those things is simple things. You don't have to buy singing bowls or or pay for Spotify. You can do things that are free, like candles, baths, and incense that cost very little money. Or butterfly tap, or go for a
Yeah,
walk
butterfly
or
tap.
dance.
Love this.
Yeah,
I love
butterfly
this.
tap.
I tell everybody to walk. Walking is so easy. It's free. You see God and everything, all around you. God is all there. Today the azaleas are blooming, right? So
Mhm.
walking is free, but I got to tell you my stress filter. Okay. And I learned this from cancer. So I have to say a bad word. Is that okay? So I learned, so my nurse,
You know, we all have a potty mouth here, Ricky.
my nurse
We're the
navigator,
GSP crew, right? You tell
I'm
people
potty mouth number 2. Yes.
tell people what that means. We're gonna mute my.
and my nurse navigator said, I said, how do I know what stress feels like? How do I know I'm stressed out? And she said, you are so stressed. She said, how many times a day do you think or say the word asshole?
Uh,
So,
or the F word.
yeah. So I
Mwah.
didn't really say it out
How
loud
many times? Yes,
a
tell
lot,
us.
but in my head, I said it a lot of times about a lot of people that were close to me, a lot of people, and sometimes with adjectives. And so now that's my filter. So if I start to even think the word asshole in my head, I will walk out of the room. I will leave the thing. I will hang up the phone. I love you. Gotta go, because that's my filter. And so that's like my temperature check. Because I had to learn that my peace is non-negotiable.
I love that.
Non-negotiable.
I'm hearing some good things here. I'm hearing that you're able to recognize when you're stressed. You know, I'm hearing that maybe you're able to not only recognize it, but to start to reverse it and to speak life and to put some things in motion, to do some affirmations.
I have a whole bag here.
Oh my goodness. What's in your goodie bag?
Oh my God. So I love this bag. It gives me life. So I have breathe. It's awesome.
Oh yeah.
What's in it? Would you tell us what is it, a mixture of?
Oh, so it makes this eucalyptus.
That's really good stuff. Really good
It's
stuff.
peppermint oil. It's leaf oil. It's citrus.
Mm-hmm.
It's what else? Yeah,
Okay.
eucalyptus, leaf oil, mentha, other things, and then I have lavender, which is amazing.
Yeah.
Lavender's my jam.
Yeah.
And then, excuse me, I have frankincense, which is one of the herbs that the gifts that Christ got. Is just so soothing, and balance as well, and more eucalyptus, and I have even more in this bag.
That's fantastic.
But
All right, so
I always say this. I think people often think that self-care is expensive, but the same people that tell me I spend too much money on oils and on these my meditation room and other things are the same friends that spend money on expensive shoes and clothing. So I say pick your thing, pick what's important to you. And so, if you have some fun and money can afford it, it's the simple things as candles and bath and scripture and journaling. If you have more money, it's investing in things that can bring you peace of mind. The shoes come and go, the purses come and go, but healthy food that give your body sustenance is your temple. And things that give your body peace of mind and sanctity are important. Your body is sacred and your life is sacred. So how do you create that space within your body and mind, spirit, and within your home? You can have a closet that you go into and meditate in, just or lay there, and have posters or post-its that have positive affirmations. You can have a room in your house where I have a room in my house, a little room. It's actually an alcove, but I put on that alcove, I put like a little table, and I have my Bibles and my Joyce Meyers and my Neil Donald Walsh, and I have my T.D. Jakes books. I have candles, and I have all these things that bring me peace, singing bowls. And so when I want to get away from my house I have 2 dogs, 2 puppies, Honey and Sugar. They're 5 months old and a year, and they follow me everywhere like babies. I just go in there and I close it off, and I literally, it's pitch black. I light like 3 candles, and just the peace that you get from sitting with a candlelight is so profound.
yeah.
Just being quiet.
Mm-hmm.
So it could be as simple as being in a room with some candles.
Yeah. And you said something really key. I say this to patients a lot. Breast cancer is the wake-up call. It is the opportunity to put yourself first like never before. And it really becomes essential. If it wasn't important to you before and everybody else took precedence, this is the time when you really need to put your own mask on. You put yourself first and get yourself in order so that you can, 1, be around for those people that you love and that you are doing so much for, but 2, so that you can come out of it with a different story. Like this isn't the end of the story. This is where the story changes. This is the part where it gets good and something exciting happens after this. And there's some life changes, and that, those toxic people, those toxic things, that toxic job, all of those toxicities we got to start to chip away at. And I think this pandemic is really kind of giving us an opportunity to do the same thing. There's some wonderful free online resources. I'm seeing it all over the place. I'm seeing free yoga. There's DJ parties going on. There's free cooking demonstrations. There is such a richness and an abundance here during this time that, you know, people really want to try to tap into that rather than to feed into your anxiety and to feed into the agitation and all the things that this pandemic is bringing. You know, Dr. Rothery, help us out here with some things that people can do and resources for them.
Yeah, so I guess, you know, while you were speaking, I was thinking about the fact that some people may need to start even further back. There are people who are having trouble getting up every day. There are people who are afraid and frightened to leave their house, even if they can go outside and take that walk, Ricky, or get some fresh air. And so one of the things that I think is important is, as Maima said, start where you are. I say to my patients, make sure you get up every day. Make sure you shower, wash your face, and brush your teeth every day. Let's start with the basics, because people aren't able to mobilize themselves to even do those things right now. Okay. And what I promise them is that if they get up, take that shower, wash their face, and brush their teeth, and change their clothes, even if it's changing into a different pair of sweats or a different pair of pajama pants, they're going to feel a little bit better. Okay. Then we talk about sleep hygiene. Many of us are staying up later than we usually do, because we can't sleep, or because we don't have to get up in the morning, so we're staying up later. And then so our sleep cycles are thrown off. There are people who are having bad dreams at night. Okay. And so our biological clocks are just, everything is dysregulated. And so we understand that that's going to happen, but can there be a little bit of structure? So you're staying up till 2 o'clock every night, maybe push it back to 1. Okay. You're not getting up till 11 or 12 in the afternoon. Let's try to get up. So the structure and the continuity and the basic self-care is critical right now. And so that's where a lot of people have to start. We also have to be gentle with ourselves. People are not as productive as they were before. I often tell my clients and my students, some days I feel like I'm moving through mud. It's like everything has slowed down in terms of my ability to move and get through. And so what do we do about that? Do we feel bad? Do we feel guilty? Do we feel horrible that we have that to-do list that just didn't get accomplished? Or do we give ourselves grace, you know? And do we give others grace as well? A lot of us have kids at home, you know, and there's homework to be done. There's online schooling. We want them all to get past to the next grade, but we have to remember everybody is impacted. And so just as we want to be easier on ourselves and patient with ourselves, we have to be patient with others who are in our environment as well. So those are some of, you know, choosing your battles. Okay. There's been a rise in domestic violence. There's been a rise in child abuse reporting. It's hard to be stuck in the house sometimes with everybody. And so tempers are flaring. People who were already vulnerable become more vulnerable. And then others in their environment may become more vulnerable. People are self-medicating with drugs, with weed, with alcohol. And so there's a lot of unhealthy coping going on. And so we want to recognize that it's happening. We want to give grace. And then we want to encourage people to try to consider healthier behaviors so that we can all be here tomorrow. We've also got people out there that have been called COVID minimizers. And those are people who are not taking this thing seriously. They're going out, they're out and about, and then they're coming home to their families. And so you've got loved ones afraid, because it's not that people are going to work as essential employees and they have their protective gear on. People are out hanging out and coming back home and putting loved ones at risk. So sometimes your home is not a sanctuary for you. Your home is not a place where you can find that peace and that joy in that moment. It's really more just about survival and doing the best that you can. It is not easy. But again, little steps and a recognition of what you can control in the moment, and then reaching out for resources when things get to the point where you don't have control anymore. And at the very end, I can give some phone numbers for some hotlines and resources for people for whom things have gotten so bad that they're not able to engage in that self-care that we're talking about.
I think
Can I,
another
can I add
one.
to what you said quickly?
Oh,
You mentioned a really important point. So people are dealing with mental health issues beyond COVID and before COVID.
Right.
Things like agoraphobia,
Mhm.
things like other disorders, bipolar disorder and other things. And so I want to give that some attention as well, because some people just can't, to your point, get out of bed. Some people are afraid to go out of their houses, and now they're afraid of COVID and leaving the house for other reasons. I never would have understood that before until I was in that place where I was depressed because I was having panic attacks daily. And I couldn't leave my house sometimes. I was afraid to go outside.
Mhm.
And I'm somebody who's very, very capable and very strong. And I think sometimes, you get to a place where you see things that you're going through. You're like, how is this happening to me? But from people who really can't get out of bed. It's all they can do to just get out of bed. They're so fatigued. They're so overwhelmed. They just want to lay in bed and just sleep. And so they can't see a way out of lighting a candle, taking a bath, doing butterfly tapping. So I don't want to minimize those, because I have people I love who are dealing with agoraphobia, depression, bipolar, and other issues. And so as we discuss self-care and using our oils, some people just can't cope because they have chemical imbalances that they're dealing with. And so these are real fears that they're experiencing that now are further layered on by COVID. My therapist and I talk every week on a Saturday now for an hour.
Mhm.
It's non-negotiable. I will forgo a pair of shoes or two or three to talk to her.
Mhm.
But she said she had more admissions in the month since COVID than she'd had in a long time. Because
Yes.
there are patients who are seeing a therapist and or being medicated, who are seeing psychiatrists, who are kind of like, they were balancing and managing out, and they just dipped. And so my question to you, doctor, is how do you give those patients who are already on the edge or
Mhm.
teetering or who are at risk, how do you get
Mhm.
them support? Because what we're talking about, like my meditation room or breathing and all those things, they're not helping them. So what can they do
Right.
beyond just that?
Yeah, absolutely. And like your therapist, my practice has been full and over full. I've taken on more clients than I typically take because people are really struggling and suffering. And so people are reaching out for help all over the place. There are the first thing to do is to tell people the fact that, if you're feeling bad, it makes sense that you're feeling worse right now, because sometimes you can just beat up on yourself and think, what is wrong with me? Why aren't I coping better? Why aren't I doing better? I'm in therapy. I take medication. I should be okay. Well, no, this is a very unnatural situation. And so all of us are taxed. And so depending upon where you fall on that journey, you're going to be taxed wherever you are. And so for people who are already vulnerable, yes, this is a very challenging time. There are some hotlines, the National Suicide Prevention Lifeline. I have encouraged people to use as a resource. And again, I can give that number at the end. NAMI, which is the National Alliance on Mental Illness, they have a hotline. And then if people are struggling with both mental health and substance abuse issues, then the Substance Abuse and Mental Health Services Administration also has a hotline. I warn people that because everybody is suffering and struggling, you might call and get a busy signal or get put on hold. Don't hang up, okay? But just use that as proof that we are all struggling right now. You are not alone, okay? But don't give up. Reach out and try to get help. I tell people, even though they're in quarantine, they are not alone. But they have to have the wherewithal to at least reach out. And I think that brings me to another tip, and that is that we need to keep our virtual village active. We need to reach out to one another. We need to have regular contact with one another. And we also, one of the things that's been so beautiful is hearing from my clients about some of the things they're doing for other people who aren't relatives. I have a client who she goes grocery shopping once a week, and she gets groceries for 2 elderly neighbors as well. I have a neighbor whose 6-year-old daughter came to my door with a gift bag with 8 rolls of toilet paper in it because her mother is teaching her to share and be kind to others. And, there's this running joke, which is not really a joke, that we can't get toilet paper anywhere. And so sometimes when you're feeling low and you're feeling down, doing something for someone else can actually feed you. And so that's another thing. So it's reaching out for help, and it's also being a source of help for others. Mobilize the village, and consider us being in this together. We've got people who are grieving and mourning because they've lost loved ones who died in the hospital without them, and now are being taken to places, who knows where, and no funeral. There are many people who have rituals. I have a Muslim client who lost loved ones. They could not do their traditional rituals around preparing the body. I mean, it's devastating. And so we talk about virtual rituals, because these rituals are for the living, right? And so how can we come together and send our loved one off the way that we would have in person, to the best of our ability, virtually? So it's about finding alternatives, okay? Finding alternatives to come as close to what we used to do that we can, as opposed to giving up. And it's the same thing with seeking mental health care. Find an alternative, reach out, don't give up.
I love these things. I think that we've got a feedback situation. Would you all mute your mics for me?
Mm-hmm.
I love that you said that, though, because there is so much trauma going on from all sides. As someone in our public chat is a first line responder and works in the hospital, and they are now having challenges, panic attacks, etc. And there will be so much, I think, PTSD as a result of this. That it's important for us to get in tune with what we feel and how we feel. And so if you are having, if you have pre-existing anxiety, depression, bipolar, all those things, now is a great time to begin to tackle those things. And, Mama, like you said, it's so hard even to maybe just get out of bed, just having the grace with yourself to say, you know what, I'm just going to do this one thing. I'm just going to get up. And then once you do that one thing, I'm just going to do one more thing, or I'm going to phone a friend and they're going to coach me through this, talk me through this. I have some friends that I can call when I'm really just at my wit's end, because, with cancer, it can really take a toll on you. And I can't hug my patients. I can't instill the sense of confidence and trust and security and all the things that make my practice so valuable to me has been taken away in the terms of making that connection with patients, because I now have a mask and gloves and they have masks, and we can't touch and we can't agree and we can't really get to the heart of who we are as people and what we want to do for their treatment. And so it's discouraging, but being able to have someone that you can call, just, contracting, as we call it, for safety, having that one person that, no questions asked. If I call you and I say, listen, I need the pep talk, give me the pep talk. I got those people in my village, and they will give me the pep talk no matter what's going on. If I've messed up someone else, whatever it is, they can help to get me to that next level of just being able to breathe, just being able to put one foot in front of the other.
Yeah, both of our organizations, Sisters Network Inc. and Tiger Lily, that's what we do all day. We talk to our breasties all day. So reach out to us, find us on social media, and, at Ricky Dub, at Sisters Network, and at NEMA, and but reach out to us, and we'll hook you up. If we can't talk to you, we'll hook you with someone who can, and try to give you, at least get you to chemo one day, or get you through that scan. We're here for you. That's what we do. We try to have the sisters, that network, that community, to get you through the things that we're dealing with, normally. But cancer doesn't stop because of COVID. But this has just escalated all those hard feelings, all those tough things that we're dealing with. So
we're now offering through Tiger Lily 14 programs around lifestyle support. So we have fitness training weekly. We have meditations on every Sunday at 10 o'clock on Facebook Live. We do yoga, Bollywood dancing, Pilates. We have a doctor on, Dr. Jen, talks about immune health and so forth. So we offer a lot of
pajama party,
a PJ party on Friday nights. We have an Instagram live DJ dancing party on Saturday. So we have things every day of the week that are around having fun and just kind of remembering that we're still here and we're still alive. And then we do daily programs around cancer and COVID and the immune health and things like that. I'm
Mhm.
doing one on intention setting next week on how to set your intentions and vision. So, I mean, I think being alone gives you the opportunity to really think about the kind of life you want to live beyond this. I think we take things for granted. Sometimes as human beings, we forget that we have so much bounty and luxury and things at our disposal. Where I grew up in Liberia, sometimes you could pay for your water and your power and just not have any water or power. Or you
Wow.
go to the store and there was not enough tissue or whatever you wanted, or meat or chicken. Or if you, to get in the store, you pass people on the street who had missing limbs. Or there'd be a soldier carrying an M16 gun. And so I think that as people, as now, living in the States for many years, I love this country. It has so much to offer, but we take a lot for granted. I think as a human race, we need to really thank the universe and thank God for what we have that we may have not honored enough Mother Earth and each other, and take time for that. And so I think going in the future, like we really have to connect more and spend more time together and check on our friends. My friends. I have 5 friends. We're called the Fab Five. The Fab Five. We talk once a week on a Saturday, and we text every day. And if I'm in a mood where I don't want to get out of bed, or I'm depressed, or I'm tired, or I'm stressed, or I'm having meetings from 10 to 10, they'll text me until I answer, or somebody will call me. So I know that no matter how bad I'm feeling, somebody's thinking about me and is going to make sure that I'm okay.
Yeah, I
And
have the same.
people need that,
Yeah, I have the same
Now,
thing with my
Emma,
gratitude.
we've got just a few minutes left. I wonder if you can tell people where to find this information, because we've got some questions in the public chat about how can they find this? Where can we follow you on social media? Because we're going to need to continue this conversation with you. People are going to have questions. They're going to want to do the dance party and pajama party. You're going to have a whole lot more breast after this conversation today. So how can people find you?
It's www.tiger, TIGER, LILY foundation.org. And under, you click on the programs page and you'll go down to the bottom. I forget the exact link. Or if you Google the Pure Cat Initiative, that's the program. So my friend and best friend and sister who passed away during the time of COVID coming out, she and I had to say goodbye via phone, via FaceTime Live. And that's something I just can't get over yet. And still missing her tremendously. But she was a yogi and loved to dance and full of energy. And I thought, what better way to keep her spirit alive than to honor her with this program, through this program. And so we offer these classes. So if you Google the Pure Cat Initiative, you'll find 14 programs. And if there are things you want to see us do that we don't offer, I will manifest that for you. So just let us know what your needs are. We're here to serve and to support you all during this time.
Fantastic.
So
Dr. Rosary, can I get to you and ask you, for people who can't find a therapist where they live? Someone commented that they can't find a therapist where they live. I wonder if you could help them or give them the website to be able to look up a therapist, but also tell people how they can follow you, because what folks don't know is that Dr. Rosary is my therapist, and she saved my life at a time when I was trying to save everybody and everything and treading water. And I will never forget. And I appreciate it so much. So how can people find and follow you on social media, and how can they find a therapist in their area?
Okay, sure, Dr. Gary. So I am not big on social media. My private practice is so small. But what you can do is www.apa.org. That's the American Psychological Association. Not only do they have referral lists for psychologists all over the country, but they have a wealth of resources. So that's the first place. The second place is www.papsy.org. That's the Pennsylvania Psychological Association. And they also have a referral list. So www.papsy.org. And then if you Google Psychology Today, they also have a resource list. I have to be honest that I get about 6 or 7 calls every couple of days, and I give referrals, and people are often full. So again, it requires patience. You have to keep trying. Somebody's going to turn up with an open slot, but it may take a while to find them. In the interim, the various hotline numbers that I shared with you might be the next best resource. I think they are well staffed, and sometimes people just need somebody to talk to. And if there's nobody in your life at any given moment, if you just need someone to talk to, then that 1-800-273-8255 number might be the number for you. Sometimes we just need to be talked off the ledge, literally or figuratively. Just hearing another voice of someone who cares. And sometimes that's people we know, and sometimes it's people we don't know, but who care about us anyway.
Thank you for that. Also, there are some. Sorry.
Oh, can I add one more thing before we get ready?
Oh yeah, absolutely. I was just going to say, and then we're going to let you say yours too. But there are some free apps that you can go to find a therapist. I don't know that the services are entirely free. They're probably membership based. But if you Google apps to find a therapist, you can find a therapist for 2 a.m. There's somebody to connect with. Yep, at any time, day or night. This age of technology is in full bloom. Thanks to our millennials and our zennials, we are able to continue life as we know it. But there are therapists that are available through different applications for your cell phone, even. So no matter where you are, there are some ways you can find a therapist. Ricky, tell us your information and how people can follow you. Also, give us all of it.
You can follow me at Ricky Dove, RICKIDOVE, at Sisters Network Inc. We're on Facebook and Instagram and Twitter. But I wanted to share my mantra with you, and we don't have time for me to read the whole thing. I'll post it in the comments. But my favorite line is, I seek order, simplicity, and peace, creating space for my blessings to increase. So thank you so much, Black Doctor, for this awesome platform. Follow us. We'll make comments in the comments. And Monique, you want to close us out?
I do, and I want to say, I want to send light and love to the family of our dear friend Jasmine Witherspoon, who passed away this morning. Jazzy was our guest 2 weeks ago. She was 29 years old with metastatic breast cancer, and our viewers tuned in for our very first show with Black Doctor, and I don't think you knew that she was home on hospice. But Jazzy gave her wings, and we send love to her family. I'm wearing my Cancer Who shirt. Al, if you're watching, Cancer Who is a Philadelphia-based support program and an actual physical center that Jazzy was an integral part of. And so I just lift all of you guys in prayer. You can follow me on social media, Dr. Monique Gary, on Instagram, LinkedIn, Twitter, Facebook, and we will continue to post some of these resources in the Black Doctor chat. So once we close the show, if you guys would go to the comment section and put in some of those phone numbers or websites or any of the resources that you have, we would love to continue this. And even Mama, if you have us on another time, we can continue to bust it up and talk about the real self-care, and I can give you my stories of how when I try to meditate, I fall asleep and it's bad. We're preaching to the choir here. So for those who are watching, we don't have it all figured out either, but we're gonna figure it out together. COVID, no
together.
This is where we figure it out. So
together we're stronger. Together we're stronger.
The doctor is in.
Thank you for joining us. Relatable. We hope it's relatable, reliable, and real for you. Next week we will be talking about sex. Who's having it? Who's not? We're going to do an uncensored conversation with Dr. Donna Adams Pickett and some of our breasties, and we're going to get into it. So the doctor is in. We'll see you next week.
See you next week.
Bye, guys.
Thank you. Bye.